Welcome back to Contemporary Business, and I'm very excited now about this discussion because this discussion is primarily about business coming together with what I think is one of the most worthwhile social causes for South Africa. It touches upon our kids in school, it touches upon our homes, and as we sit in our gardens and as we go through our homes, the fact that there are poisons, the fact that there's toxicity wherever you look in civil society and uncivil society here in South Africa. And I'm so pleased to be joined by Dr. Bradley Browne, who is the foremost expert in South Africa on this issue of toxicity and poisons, and by Tara Benn, who is the Chief Executive Officer of the South African Paint Manufacturing Association, and importantly of the South African Coatings Confederation, which essentially is the Paint Manufacturers Association, the Surface Coating Employer Association, the Waterproofing Trade Association of South Africa, and the Retail Paint and Hardware Association, which is part of this Coatings Confederation. So welcome to both of my guests, and thank you so much for joining me. So Tara, let's start with you. You and Bradley met at the MCCM meeting that you've been a part of, that SAPMA is a member of, and that's a government committee. What is its intention? What is the purpose of that meeting?
The MCCM stands for Multi-Stakeholder Committee on Chemicals Management. So within that committee that meets on a quarterly basis, various discussions around chemicals, safety, and handling of chemicals are discussed, as well as various imports and exports of chemicals within the coating sector. Through how we met is through MCCM, where Brad, on a quarterly basis, provides feedback to the MCCM committee with regards to poison cases that have been recorded, and the amount of calls that are received through the Poison Centre with regards to chemicals and chemical poisoning within the various provinces in South Africa.
So, Brad, that's such an interesting question, I think, that arises from what Tara's just said, because the question is this: do you get a lot of requests? And let's put you into context. You were the director of the South African National Poison Hotline, which essentially is run out of UCT University. And it's a national hotline which is available to members of the public, to corporates, to businesses. If there is a problem with toxicity in terms of products they're using, if they've been bitten by a snake or by a spider, the reality is that South Africa is absolutely dependent on your hotline. People in this country are absolutely critically dependent on knowing what they've been infected with and how to treat it and how to deal with it and how to handle it. And so here's my question to you. Do you get a lot of questions in relation to people in factories and manufacturing plants, to suppliers who are bringing new products into the country, about the toxicity of their product?
Overall, we receive about 13,000 calls a year in poisoning-related incidents. A lot of them are actual exposure incidents where someone has been exposed to a specific toxin. And then and that is obviously in the kind of residential, non-formal sectors, but then also at factory working level. And then we also do get queries when people are handling certain dangerous chemicals or products, advice, how toxic is this product? How can it get absorbed into one's body? And that just, I think, gives people a bit of a better sense of how they can protect themselves.
So, Tara, here's a question for you. Is there a labeling law in South Africa that actually talks about finished product and displaying on that finished product the level of toxicity, the nature of toxicity? Or in fact, are we as the consumer left to guess about the toxicity of a particular product?
Currently, suppliers and manufacturers of finished product need to adhere to the GHS regulations in terms of labeling. That's the Global Harmonized Systems. And currently, South Africa are forced to adhere to those rules and regulations in terms of pictograms and information in terms of toxicity that is put onto labels of finished product as well. So it is compulsory for manufacturers to put that information on can. However, I do think that it's more of a high level overview, and as you say, consumers that are not aware of what those pictograms are about would probably be left in the dark. But in terms of compliance and legislation, it needs to be placed onto cans for finished product. But I do think that the consumer and the wider community could be better educated in terms of toxicity and what that information really means, and the pictograms on the cans actually really stand for.
Brad, what do you do in terms of education? How far does your mandate or your responsibility or your sense of self-management extend to informing the public, to informing children, to informing their parents, to informing adults, to informing the consumer about toxicity and poisons?
So we have quite a few different spaces in which we're involved in education. There's the medical practitioner space, and then there's the public space. So from the medical practitioner point of view, one of the key gaps, I would say, is that training on clinical toxicology, on assessment and management of poison patients is not actually a core learning outcome in medical undergraduate or even postgraduate curriculums. And so this creates a gap. It creates a gap in that, general medical practitioners and specialists need to be continuously educated, upskilled, in-service training to make them more competent, more capable of managing poison patients. And so that's something that we really focus on. We go province by province. We do regular training to medical practitioners at all different levels. And then from a public point of view, we really like to partner with organizations to help get our poisoning prevention and educating messages out there. So partners like SAPMA, using mediums like the MCCM and getting involved with education practices which are already happening. There's another organization called Child Safe, which we work with quite closely on poisoning prevention. So we like to leverage those relationships and contribute to well-established training programs which are already on the ground.
Brad, I notice from your promotional literature for the National Poison Hotline that there is an intersect between the physical component of the problem that you are dealing with on a daily basis, which is the fact that people get stung or people ingest poisonous substances, etc. Like, for example, sodium nitrate. And there is an opportunity for self-harm to occur. And so there is an intersect between that physical reality of what you deal with and the notion of mental well-being, mental health stability. And your center works with mental health professionals to actually tackle the notion of addiction, depression, etc., which may result from this intersect. Do you want to talk a little bit about that?
Sure. Thank you. Yes. Yes, it unfortunately is very prevalent that a lot of toxic exposures are related to self-harm in South Africa, especially in the adolescent group, but also among adults. And absolutely, if you think about the care pathway, of someone who has now been exposed through self-harm to a toxin, there's the initial phase of stabilizing, but then there's also the phase of trying to get them back on their feet, supporting them socially, psychologically, so they can lead a healthy and fruitful life. And that's a very important component of care that we're involved in too. We ourselves are not psychologists or psychiatrists, but we work very closely with the teams that are caring for these patients. One thing I will say, there's been a lot of research globally, especially by an individual called Michael Edelston, who is a global toxicology researcher. And it's interesting that in the case of self-harm poisoning, a lot of the vast majority of the cases are not premeditated in the sense that, someone has been planning this for a long time. It often occurs in a moment of distress. There's been an argument, there's been something that's upset, and as a method of communication, as a cry for help, someone reaches for something that's in their environment and ingests it, not necessarily meaning to in their life, but more as a method of communication. And so if you're able to medically guide that person through that event and provide them with the correct support, then they will be fine.
A skeptical business owner might say this, that today, with the advent of AI, with Dr. Google, why do I need a hotline of this nature? I can go online at any moment in time and get this advice and be told specifically what I need to do. What would your response be to that? And now I need to emphasize, I am talking to Dr. Bradley Browne, not just Bradley Browne, a call center operator.
I love that question. As a background to my stance on AI, I'm really excited about AI. I think there is a huge amount of opportunity coming in the future. I think that there will be a lot of benefit and change to the medical system, to toxicology in specific. So I'm excited about the future and using AI as a tool to help us. We have in the past year or two been quite active in our exploration of how we can use AI in our systems, in our poisonings database, which is called Afratox, as well as in our actual helpline system and the data that comes from that. As it stands, there's two main concerns. One is the safety. So as it stands, if you're relying on AI or even a specific LLM to provide medical advice or medical assistance, you need to be 100% sure that that medical advice is going to be sound and it's not going to lead you astray. And unfortunately, we're not there. We have used AI in multiple different settings, tested it. There's been quite a few academic publications on it. And the incidence of hallucinations, of incorrect advice, of incorrect referencing, we're just not there yet. It's not a safe tool. And so where does AI sit in this space? I believe that I'm hoping we one day will be able to use AI as a tool to make us more effective as what we do. But I don't see in the near future AI being a replacement for sound medical advice. We're just not there yet.
Let's talk a little bit about this Afritox database that you have created and you continue to create. One would assume that there's a global tox database which is available. And so my question is, what is the necessity? What is the reason for you having to focus as much of your attention on the development of an African toxicity database as opposed to simply linking in, buying in, plugging in to a global toxicity database? What's the need to Africanize this database?
Thank you. I think I'll start off by answering that question with the problem that Afratox is actually trying to solve. So there's two components of the problem. One is that poisoning is an emergency. All the risk that happens when someone is exposed to a toxic substance is compressed, it's squeezed into a few hours. And you need to act within those few hours to ensure there's a good outcome. The second component of that is there are tens, hundreds of thousands of potential toxins out there. We're talking chemicals that are in the industrial and the household sectors, medicines, pesticides, and biological toxins, snakes and plants. Tens of thousands of different things which could poison you. And you can't expect one medical practitioner, even a specialist medical practitioner, to have all the information, the entire approach on hand to each one of these clinical scenarios. And so Afratox tries to solve this by over 40 years, 4 decades, we've been generating a clinical poisonings database that contains more than 40,000 different toxins and products which are specific to South Africa, and the treatment guidelines that
Did you
go
say
along with it.
40,000?
40,000,
Are
yeah.
you saying that there is a, this isn't what you're saying, but it could be inferred that what you're saying is that there's a variation from the global toxicity database of between 20 and 40,000 of African specific toxicity causing products or processes?
Well, There will certainly be overlap in chemicals that are present ubiquitously around the world, but this database is specifically focused on the South African and African setting. As an example, maybe a story, we had a case a few weeks ago of a small child who was bitten by a Cape cobra, and that child managed to reach the hospital in 30 minutes. By the time they reached the hospital, they were already paralyzed. So you need to have an approach to the poisons, the toxins that are specific to your area so you can save lives. And so that's what Afratox does. There's also a range of chemicals, pesticides, other products which are unique or common in our setting that we need to have our healthcare practitioners aware of and equipped to manage. Funding is a challenge for us, unfortunately. So as it stands, we run this national poison helpline service, which is supposed to be a 24-hour service in which anyone at any time in the country, whether you're a medical practitioner, whether you live in a city, whether you live in a rural community, can at any point access specialist toxicology advice to help you in your current situation. That might be a question of, should I take my child to hospital after they've just had a sip of this bleach product at home or drink out of the paracetamol bottle? It might be a medical practitioner saying, I've got a very complicated case here. How can I manage this patient optimally? And so that's the service that we provide. Unfortunately, from a funding point of view, where it stands is that our daytime operations and the actual core architecture, the expertise, the infrastructure for the service is fully and sustainably catered for. But there's a large gap in our after-hours service. And as you can imagine, after hours, the late evening, the early hours of the morning, this is where individuals and medical practitioners have the least support. And this is when they really need support, when they're dealing with an emergency situation. And so currently our after-hours service is actually not functioning between 1:30 and 8:30 in the morning, which is unfortunately leading to us we've missed 2,000 calls in 2025, which directly translates to patients and individuals not getting the care they need. So that's an ongoing challenge for us.
So Tara, this allows us to segue into what we're doing on this podcast, on this interview, because it is really you that identified this as an opportunity for the Coatings Confederation to actually come to the party and say, well, we manufacture paint, we sell and distribute paint and coatings product, so we need to bear some kind of responsibility for making sure that at the very least, insofar as it touches our product that we put in the marketplace, but more importantly, as a social consciousness project, it's a perfect opportunity for a relationship to be created between the National Poison Hotline on the one hand and the Coatings Confederation on the other hand, saying to our members that here is an opportunity for you to put something into civil society. And by the way, in terms of the broad-based Black Economic Empowerment Scorecard, there is a particular element called SED, the Social Economic Development element, that allows you to make those contributions to a national fund we're looking to create as the Coatings Confederation. It allows you to partner in your best interest as a company, but more importantly, in the national interest. Do you want to talk just a little bit about that?
I do think that as responsible SAPMA members or anyone within the Coatings Confederation, I do think that it's their responsibility to make sure with them working with toxic products and chemicals that they support such initiatives and be part of the community that not only educates but gives a support line and assistance where necessary.
So what you're really saying is that members of the Coating Confederation, of SAPMA, of WATASA, of the SCA, of the South African Retail Paint and Hardware Association need to be aware, need to look out, need to be prepared for a series of communications to them about the opportunity for them to partner in this very, very meaningful project between the Coatings Confederation on the one hand and the National Poisons Hotline on the other, so that they can actually take that 1% of net profit after tax that they're required to actually be spending on social economic development projects and see this as a worthwhile opportunity for a partial contribution of what they have to spend anyway, but on this activity in this relationship with the Poison Hotline.
Yes, I agree with what you're saying. I do think that as you say, it's spend that they are using already with in terms of their triple BE scorecard. And I do think that sometimes companies are unsure of how to spend that money effectively. And I think that this is a perfect opportunity to be able to know where the money is going and that the cause is absolutely necessary at this point in time.
All right, I know that you've been very passionate and outspoken sometimes about this idea that what we sell as coating product, as paint, as varnish, what we sell alongside our coating product in our retail and paint and hardware environments is very much consequential sometimes in the fact that in, for example, the factory environment, it is possible that working with toxic substances, and I'm going to use lead as one of the examples that has just been put to bed in terms of national legislation, that there is an opportunity, that there is a danger of actually long-term effects on the people who work on a daily basis with those products, either as a contractor applying those products to homes and to offices, etc., or in fact as someone who works on the factory floor of a manufacturing environment. Talk a little bit about that, because I think that that is one of the driving forces that SAPMA and the Coatings Confederation seems to regularly express in terms of public responsibility and accountability, at least to be able to educate the public.
I do think that that consumers are aware from a retail perspective, and employees are aware in terms of being in the manufacturing environment, what PPE protective material that they need to use, and what is available for them. And I think that the consumer is very aware of PPE. And what is available and how it should be used within the environment that they are placed in. From a work perspective, it gets a lot more technical. So you wouldn't just use a standard mask in that environment. You would have protective clothing, you would have protective masks. But yes, in some instances, some of the toxins still manage to leach through, and there have been numerous cases of people working in the manufacturing environment, whether it be finished product, whether it be the actual manufacture of the raw materials, where later on in life they have picked up that working within those environments, that they now suffer from chronic diseases. For instance, sometimes heart disease, lung disease. And often those are related to work environments and the toxins and the toxicity of the environments that they have worked in for many years. And I don't think at the moment, and this is probably something that SAPMA as well as the Poison Centre could work on, but to have that availability to educate members or employees within a working environment, that there is the Poison Centre available, and that if they do feel that they have been exposed at dangerous levels, or even just exposed on a daily basis, that they could call the Poison Centre and find out more information in terms of how they could work more efficiently, or what PPE would be available for them, suggested by the Poison Centre, to make their environment a lot more safer and for their health as well, to make sure that later on in life that they don't suffer from working in those environments where there's a lot of toxic chemicals and manufacture thereof.
Bradley, how do people find the National Poison Hotline? How do they contact you? How do they interact with you?
So we hope it's fairly easy. We have our helpline, which is available for 17 hours a day as it stands, 0861 555 777. A quick Google, quick AI search will bring you there. If you just search for Poison Helpline or Poison Centre. We also have email addresses. So us here at the Red Cross PIC, afritox@uct.ac.za, or poisonsinformation@uct.ac.za. People can get in contact with us for specific questions, for general questions, for specific poisoning cases. We're open and we're available to engage in.
Dr. Bradley Browne, Tara, Benn, thank you so much for joining me here on Contemporary Business. And I think that this is an extremely exciting project. It's a necessary project, but I think it's a very exciting project. Gives us an opportunity to make a difference in civil society in South Africa. And I want to thank you both for participating.